So thank you all for joining us at the Royal College of Pathologists new trainee welcome day for chemical pathology this year. My name is Ronan McMullan. I'm the Clinical Director for Training and Assessment at the College, and I'm chairing this morning's meeting. And there are lots of people here today to give you a guided tour of your training. So first of all, welcome. Welcome to the Royal College of Pathologists and to a pathology specialty. I hope that you all have a challenging and fulfilling career in chemical pathology, as many of us in the pathology specialties have done for a few decades. I'm a medical microbiologist by background, and of course, we're one of the many pathology specialties that the college looks after. So the purpose of today's meeting is to give you an overview of how the college supports your training, and also to give you an idea of what the college does more generally. But before we begin, I'd like to just go through a few housekeeping issues. First of all, to tell you that today's webinar is being recorded. But I'd like to reassure you that your names will not be seen whenever the webinar is played back, and the webinar will be put on the college website in about a week or so for any of you who have missed any bits, or for any of your colleagues who are unable to attend today. We'd really like you to ask questions. Please feel free whenever the presenters are giving their presentations to add some questions in the Q&A box, and you'll see down at the bottom of your screens there's a Q&A box where you can type questions. Your mics and cameras are not enabled for this webinar, so you'll not be able to be seen or heard, but please do type your questions. And the other thing is that we'd really also value your feedback, so either during the webinar or towards the end, if you'd complete some feedback on Slido, which will appear in the chat near the end of the webinar, that would be great too. So today you'll hear about what the college does. You'll hear something about this layout of your curriculum and the assessment system that you work within as you progress through training. You'll hear about the RCPath exams. You'll hear about your ePortfolio, the LEPT system, and you'll hear about the pathology portal. So there's a lot of ground to cover, and I think it might be useful to be able to dip back into the pre-recorded webinar at some point. But just before we begin with this morning's presentations, I'd like to introduce a few people who are not speaking throughout the course of today, because there are some people on today's webinar who are really very important in your training and who you will rely on as the years go by. So first of all, the training team. We've got Jenny McGinley, Louis Nyerere and Adebia Kufo, and the training team really look after the queries that you have, the queries that your trainers have, and they bring together the paperwork that needs to be brought together so that you're recommended for a CCT at the end of your training. So I'd just like to invite each of these three folk to introduce themselves briefly to you. Jenny, shall we start with you?
Yes. Hi, everyone. I'm Jenny McGinley. I'm the training manager at the college. Nice to meet you all.
And Louis.
Morning, everyone. I'm Louis, and I'm the training coordinator at the college, and I look forward to working with you.
And Adebia.
Hi, everyone. I'm Adebia. I'm the training coordinator of the college.
Lovely. And the other team that is really important during your training is the assessment team. And the assessment team comprises Sandra and Alastair, and you're going to hear from Alastair later on, but I'll invite both of them to introduce themselves briefly. So Sandra first.
Hi everyone, I'm Sandra Dewar. I'm the assessment manager at the college, and part of my role is to develop and maintain the LEP system, which is your ePortfolio. So my colleague Alastair will carry out the demonstration later today. I also have overview of college staff in relation to the pathology portal, and Luke will be giving you a demo of the portal later on today.
Thanks, Sandra. And Alastair, do you want to briefly introduce yourself?
Absolutely. Hi, I'm Alastair. As Sandra mentioned, I work as part of the assessment team to help keep LEPT ticking over, and I'll be one of the main points of contact throughout your training. If you have any issues with the LEPT system, any queries, that sort of thing, I'll be available via email and phone to help you through anything you may have issues with.
Thank you, Alastair. So our first presentation today is from Dr. Bernie Croal, who's the president of the college and is also a chemical pathologist. So in just a moment, Bernie's presentation will begin.
Hi everyone, my name is Bernie Croal and I'm president of the college. I'd like to welcome you today to our new trainee day. Sorry I can't be there live today, so I pre-recorded this message. Pathology is hugely important to healthcare, which I'm sure you all know, with up to 95% of healthcare interactions involving pathology, ranging from blood tests to histology to the multitude of other services pathology offers. We are 17 very different specialties in pathology, and we welcome everybody from everywhere who's part of our pathology family to be represented by the college, and it's with that I welcome you today. Our 17 specialties cover a diverse range of interests and areas of healthcare, some of which involve direct patient contact, such as with hematology, microbiology, and ChemPath. This may be ward-based activity, outpatient clinics, and even directly with patients using home testing. And in some cases, this may involve the complete management of patient care with overlap to areas such as general medicine. But we are all vital to healthcare nonetheless, and we work together across both the pathology disciplines and also with much wider ranging multidisciplinary teams, MDTs, across primary and secondary care. So something for everyone, really. You will, of course, inevitably be linked to only one of these disciplines as part of your training, but knowledge and collaboration with the whole of pathology is going to be important both as a trainee and as a future consultant. So what are we about? Not just diagnosis, but also screening, prevention, and directing and delivering treatment to patients. There are many opportunities both as a trainee and as a future consultant, such as research. Pathology is vital for most clinical research because we are so pivotal to patient pathways. So not just research looking at new tests, but also using our tests to gauge the success of new treatments, such as drug trials, which are hugely dependent upon the need to monitor the success of any new drug by using pathology testing. Doing research can mean lots of things, of course, and does not necessarily mean going down an academic training route or even a future academic job. I have spent time both in academia and in the NHS, and research is just as important in both. So as trainees, becoming interested, linking up with existing research teams, volunteering your time, developing your own ideas, getting involved, that's the key message here. And there is no quick route. Research activity needs to be built up. Get some ideas, get some data, present at local meetings, develop abstracts, posters to larger meetings, and even oral presentations may come your way. And finally, publishing. But publishing is not the be-all and end-all. Initially, it's usually as a minor offer as part of a team, hence the importance of lining up with established work. Yes, volunteering and doing some graft. Some you win, some you lose, but you need to be in the game to get anything out of it. Teaching is another area that holds numerous possibilities, and as trainees, you will begin to deliver important pathology teaching to undergraduates, postgrads, early stage trainees, scientists and allied healthcare professionals, many of whom will form part of your future MDTs. And you will also learn from them. I've learned a huge amount over the years from clinical scientists, biomedical scientists, and other areas outside of PATH, such as dietetics, nursing, and so on. Teaching and research, of course, go together and will continue to be part of your future careers, whatever you do. And of course, they will form the basis of those of you who do choose pure academic careers. Within each specialty, there are, of course, options for specialising in specific areas. This needs some thought, as it may be linked to both your interests or indeed an essential requirement for a future job you may want in a particular place. Every pathologist is different, every job is different. Looking back, I specialise mainly in intravenous nutritional support, cardiovascular risk, and bariatric surgery services. Research-wise, demand optimization, large randomized control trial support, and new biomarker innovation were some of the areas that I focused on. Some of this, of course, happened by accident, but some of it was also my choice. There's no rush to finish training and move to that CCT point in as short as possible time. You may find yourself at the top of the training escalator very quickly, but you may not be competitive enough to compete for that job that you want. Take your time, expand your portfolio and CV so that when you reach the end of training, you can get to the jobs that take most of your interest. Job opportunities are much wider than the past, and there's a lot to think about. It's not just about NHS careers. There's academia, there's industry, private sector, jobs abroad, and even other sectors. I'm a biochemist, good with numbers arguably. And even areas like hedge funds are after people like me. Well, not at my stage, but certainly trainees coming out. But don't forget, while you work hard and you get paid for that, you are inevitably costing UK taxpayers to train you. So at least personally, I have always felt an obligation to remain within the NHS as much as possible. And that is more important now than ever before, given the challenges this country faces. So don't forget that, although inevitably it's your own choice. Work-life balance within pathology is good, and it may be a reason why you chose it. Flexible working is now easier to do both as a trainee and a consultant. Working from home or indeed anywhere is now possible with online MDTs and reporting and digital pathology opening up many new doors. It does not mean we work less, it just means we work differently and have more options. So while personally I have not had to spend, for example, a single night working in hospital because of my job, I have chosen at times to work long hours and volunteer my own time because I want to, either to benefit me, my department, or patient care. But most importantly, choosing to do it rather than having to do it is what makes all the difference, in my opinion. The college is a relatively young college, forming in 1962. It's here to support all other pathology specialties. This means that whatever specialty you are in, the college is there to support you, to help you, and to lobby for you to have the support and resources you need to be able to provide the healthcare outputs to patients that they need. We facilitate rather than directly deliver training, of course. That's mostly done locally. However, we do write the curricula, deliver examinations, host training portfolios, and sign off the CCT at the end. We also provide many useful learning opportunities, such as the Developing Pathology Portal, an award-winning platform to assist learning and examination preparation. Also, there's a multitude of webinars, tutorials, and symposia that will come your way. We have a trainees committee. Please try and get involved, and many other activities associated with public engagement, media, and learning. So there's lots to do. Let me finish though with some harsh truth, some elephants in the room. We all work in medicine at a very difficult time just now. Under-resourced, understaffed, waiting list pressures, financial pressures, and in some cases failing services. There are no short-term fixes. This may at times, of course, impact training and make the day job harder. I urge you to try your best to be more sympathetic and more of a team player, supporting each other, wider colleagues, and of course your trainers when times are tough. Secondly, another hot topic is exams and exam cost. Exams are expensive. I know this. As a college, we deliver multiple stage exams for the 17 disciplines and other groups. We only have a small but dedicated team backed up by hundreds of volunteer examiners. Yes, volunteers, we don't pay them. We do not also make any profit out of exams. The cost of exams is what it costs to deliver them. So we keep the cost as low as possible, but despite this, we recognise the difficulty, especially in today's climate. And so make sure you take advantage of things like tax rebates that are available on exam fees to help reduce this burden a bit. Your journey with this college begins now and will hopefully span your entire career, supporting you in CPD, education, guidelines, standards, and of course, representing the profession to government, the media, and the public. Colleges are going to be a vital part of your future careers for your future professional well-being and the standing of our disciplines. But remember, colleges are not a them and us situation. We are all largely volunteers, including me. You're part of this college now. This is not my college or indeed your college, it's our college. I wish you all the best in your future careers and especially the training period you're now entering. You will not regret your choice. Thank you.
Thanks very much to give you all a little more of a feel for what the place the college has to play in terms of your futures. Staying on that theme, our next presentation for this morning is from Joe Brinklow, who's the Director of Learning at the college. Joe oversees everything about training and assessments and exams, and is a fantastic source of information whenever we find ourselves in a tricky situation. So Joe's going to tell you today about the role the college plays and basically what the college does, so you have a really good feel for how it all works. So I'll hand over to Joe now.
Okay. Good morning, everybody. It's really nice to see you all this morning, albeit virtually. As Ronan said, I'm Director of Learning at the college. I'm also a member of the senior management team here, and I'm going to talk a little bit initially about what we provide for you in terms of your training pathway, but I'm going to expand out a little bit and talk a bit more broadly about the college as well. So, as Bernie and everyone else has said, welcome to your college. There is a huge array of work that goes on in the college, but primarily when you join us as a trainee, all of the things that you see here on this screen are probably the primary things that you will engage with. The college has a large number of committees. I know we keep saying it, but it's really important to remember that the college has a huge number of specialties. The official number is 17, but with all of the subspecialties and special interests and things, there are a lot of different specialist areas that are covered by the college. And the main specialties all have their own committee where they discuss the things that are important for them and important for their specialty, and producing guidelines, flagging issues and all of those kinds of things. Within the learning area, there are also training committees. So we have one for chemical pathology and then one for cellular pathology, and then some infection committees as well for the other specialties that we look after. And as Bernie said, you'll be hearing from some of the trainee reps that sit on our trainee advisory committee as well. You hopefully will have had a look at your curriculum, and again, I'm not going to sort of do any spoiler alerts for some of the things that are coming up later, but you'll already know that through the assessment team we develop all of the workplace-based assessments, and then the college examinations as well, and also the LEP system, and you'll be hearing from Alastair about that later. To complement the curriculum and all of the things that go along with that. We also produce ARCP guidance as well. They're really helpful just in terms of providing a summary for you every time you're coming up to the end of the year and preparing for your ARCP, just about making sure that you've done everything that's expected of you. So please make use of those. You'll be hearing again from Luke about the pathology portal, so I won't talk about that. But the college can also provide lots of advice and guidance for you throughout training. Most trainees at some stage might decide to go out of training for a period, perhaps to undertake research or to undertake training elsewhere for a little while. Or might decide to train less than full time or have periods of absence from training. And all of the way along, you can contact the college at any point for advice about that, the effect that that might have on your CCT. We're just about in the next couple of weeks to release some new guidance for all trainees about processes for having various periods of training approved and perhaps accelerating training. So please keep a lookout for those. Now you're registered with the college, you will receive that information automatically once we publish it on our website. And as Ronan's talked about, it might seem a very long way away now, but it will go very quickly. When you come to the end of your training, the college is also responsible for recommending you for the award of your CCT. And that's why it's so important that we gather the information about your progress through training all the way along, because our responsibility to the General Medical Council, who issue that certificate, is to reassure them that you have completed the training that's set out in our curriculum. The college is UK wide, and also we have a large number of international members as well. About 25% of our members are from outside of the UK, but there are regional structures in place within the college. There are regional councils. Just last week we had a Celtic summit at the college, listening to our colleagues in Northern Ireland, Scotland and Wales about some of the challenges that they're facing. And also, obviously, as you'll know, your day-to-day training takes place where you are in your location. So there is external input to deaneries, LEPBs, whatever the new name for them is at the moment, to your training at certain points as well. So having an external rep on your ARCP, for example. One of the other roles that I have in the college, in addition to training exams and assessment, is to oversee the work of the college's international team. That's primarily because there is a huge interest in the college examinations. They are internationally recognised, and there is still a lot of interest from international medical graduates to come to the UK and undertake periods of training with us. And perhaps you might have benefited from this already, but we do provide support for international medical graduates with GMC registration. Thought I would also mention our webinar resources that are provided through International, because a lot of those resources will be helpful to you as well. So, for example, in the last couple of years, we've undertaken some funded projects with the Ghana College of Physicians and Surgeons, who were rolling out their own curricula in a range of specialties, including chemical pathology, and asked us to provide a series of webinars to support the learning for those curricula. And you'll be able to find all of that on the college website and go back and have a look at those webinars, and they will be useful to you as much as they were of use to the trainees in Ghana. And we're also currently undertaking a much larger chemical pathology project that's based primarily in Nigeria, Ghana and Kenya, and that's really around improving training standards and professional standards in chemical pathology, where there are, in some of those countries, a real dearth of chemical pathologists, and trying to support the faculty there and build them back up again. So very soon you will start to see a huge number of resources available on our website. We have monthly and quarterly webinar sessions all around chemical pathology professional development, and there's going to be a series of point of care testing webinars as well. So again, do keep an eye out, because all of that will be freely available on the college website for you to dip into whenever you would like to. Just to slightly change the subject for a second, I just thought I'd mention the Totem Pro card that we offer to our trainees, or offer access to, I should say. So we have teamed up with the Totem company. You can buy this card. I think it's about £15–20 for a year. If you buy it for up to 3 years, it obviously works out much more cheaply. And it does give you access to a range of really good discounts for lots of different things, including train travel, but also discounts at a range of shops, both online, in the high street, and all of those kinds of things. So do have a look. I would say that quite often they do a really, really good deal around Black Friday, where they sort of reduce the price quite a bit, which is coming up fairly soon. So keep an eye out for that if that's something that you're interested in. So what else does the college do? So the college has about 70 staff. There are 5 different directorates, so including learning, but there are 4 other directorates. And the college really provides services to our members throughout their career, and that starts even, when you might be thinking about a career in pathology. So we do quite a lot of activities to draw attention to undergraduates and foundation doctors about a career in pathology, trying to encourage them to think about that. We understand that sometimes it can be difficult when you're an undergraduate and you're faced with a very wide curriculum to really get to grips to know about what pathology as a career can offer you. So we have a range of things that we do. One of the things that's really one of our primary focuses at the moment is looking at workforce. In many of our pathology specialties, there are shortages, and so the college is taking a lead in gathering evidence about that, gathering evidence about our workforce, not just numbers, but also looking at things like well-being as well, and using that evidence to lobby government to advocate for pathology services. Most recently, we submitted a submission to Lord Darcy, who's undertaking a review on behalf of the new government of the NHS, and you can see information about that on our website and what we said. We also provide continuing professional development portfolio and revalidation support. There are guidelines, data sets, all sorts of information that come out of our committees to support you, and you can use those as you're developing in your career as a trainee as well. You'll also receive the Bulletin, which is a quarterly magazine for our members, and lots of other things there. As you can see, there's a series of webinars that take place that support all of the different specialties in the college. And we also engage with the public as much as we can to try and improve the understanding of pathology. And this is just a screenshot of, again, this is from the website. So if you had a look on the homepage of the website, you'd see the squares to the right of this screen, and the document on the left, the election priorities, was what the college put together prior to the general election earlier this year to really highlight the importance of pathology, making sure that the new government that were coming in were aware of that. And then the team have been working since then to make links with new MPs and raise the issues that are important to us. I think you'll probably see this slide a lot. I think a lot of people provide this slide, but there is a whole section on the college website as well that's dedicated to trainees. And if you look on there, you will be able to find all of the information that you need. So your curriculum, your syllabus, the assessment information that we have available, the exams information, and so on and so forth. So please do take a look at that. The other thing I thought it'd be just important to make clear is how the college works with other organisations. I think sometimes it can be difficult to understand the different responsibilities that different organisations have. Now, I suppose what I would say is that if you're ever not sure, and I always say this every year, if you're not sure, contact the college, and if we can't help you, we can normally point you in the right direction of the organisation that can. But as a college, for our training and assessment and examination activities, we're regulated by the General Medical Council. So our curricula, our examinations, assessments, any changes that we make to them have to be approved by the GMC and have to meet the standards that are set by the GMC. You will probably get to know the teams in your various deaneries quite well as well. And we work with them closely around ensuring that we have all of the information about your progress through training. And you'll also obviously then going right down to the bottom of this table, you'll be working in individual hospitals, trusts, and so on and so forth as you work your way through the training programme. We also work quite closely with all of the other medical royal colleges. The Academy of Medical Royal Colleges brings all of those colleges together. Quite often, some of the cases that we're making are common across all of the specialties. So we do keep in touch with colleagues from those colleges as well. These are just some of the documents that I was just referring to when I was talking about, how we're overseen by the GMC and the standards that we have to meet. So excellence by design is the standards for the development of postgraduate curricula. Those are fairly new standards, and all of our curricula are updated in 2021 to meet them. As part of that work, we had to also ensure that we incorporated the General Professional Capabilities Framework into our curricula. And then the Promoting Excellence document is more for the deaneries. So the deaneries will implement the training that is set out in the various curricula that we produce and other colleges produce, and those standards apply to them. Just also a reminder that there is a national trainee survey every year. I think the report for the most recent survey has just come out in the last month or so. But again, it's really important that when those come round, you respond to those and give your feedback to the GMC, and that information is used and looked at to see where improvements can be made for training and support through training. And then just a quick overview of the role of the deaneries. So obviously we've got the Four Nations, and they're overseen by NHS England, NHS Education for Scotland or NES, the Wales Deanery, and then the Northern Ireland Medical and Dental Training Agency. And just on the bottom right hand corner there is just an oversight or overview of what the deaneries do and their role and responsibility in your postgraduate training. But as I say, if you're ever not sure, you can contact us and we can help point you in the right direction if it's not something that we can help you with, if you have any queries at all. And then just another very quick overview. It's really easy to remember the college email addresses because they're all follow the same pattern. But this is just a quick overview of who you can contact in the college if you ever have any questions about certain things. There's also an info at, so if you're just really not sure, just email info@rcpath.org and it will be sent in the right direction for an answer. But these are the four main teams that you might need to contact if you've got any questions, any queries, or even if you want to get involved in some of the work of the college. And that's everything from me. Thank you very much.
Thanks very much, Jo. That was a really nice overview of what the college does, and in particular, how we can help support training. So now we get into some very much more specific chemical pathology material. And our next speaker is Dr. Vinita Mishra, who is a very experienced trainer in chemical pathology and currently chairs the college's specialty training committee in the specialty. And this committee comprises all of the training program directors from all over the country. Your training program directors will be on this committee. And we aim to ensure that we provide good oversight of training and keep the curriculum up to date and provide advice when required about how the training processes in the various specialties work. So Vinita chairs that committee and is the best person to give you a summary of your curriculum and what lies ahead for you. So I'll hand over to you, Vinita.
Hello, everyone. Can you see my slides? So welcome all the trainees into the Chemical Pathology Training Program. In this presentation, I'm going to give you an overview of the Chemical Pathology curriculum. We shall understand the role of chemical pathologist, followed by the training pathway in chemical pathology, its curriculum and assessments. So as you all know that the chemical pathology, which is also called clinical biochemistry, is the specialty involved with the analysis of the body fluids to help with the diagnosis and monitoring of the disease. The metabolic medicine is an integral part of chemical pathology, and this involves the study of metabolic pathways in the body, which helps in treating the patients with underlying metabolic disorders. The chemical pathology is therefore a safe and effective patient care specialty, which provides the patient care through investigations and clinical care in the NHS. The role of chemical pathologist is dual, involving both laboratory and the clinical role. A chemical pathologist provides the clinical and scientific leadership to the clinical biochemistry lab, helps with the interpretation of the biochemical investigations in relation to underlying clinical conditions, gives advice to the clinicians in managing the patient's biochemical abnormalities, developing the protocols and guidelines in treating the biochemical abnormalities. Chemical pathologist is also a link between the laboratory and the clinicians by participating in the MDTs, including endocrine toxicology or genomic testing. And finally, the chemical pathologist also provides support to the clinical biochemistry specialty through research and audits. Chemical pathologist practices the metabolic medicine and therefore is involved in managing the screening program in antenatal, neonatal, and cancer, leading the clinics in managing the cardiovascular disease risk in the patients, provides direct clinical care in managing the metabolic disorders which are related to the lipids such as familial, and carrying out the CVD risk assessment, managing the patients with the bone and the mineral metabolic disorders. The chemical pathologists, they also participate in the nutrition support team and provide the supports to the patient on parenteral and enteral support. They also assess the cardiovascular risk and helps in treating the patients with diabetes and hypertension. A chemical pathologist develops an expertise in the inborn error of metabolism, managing patients with the adult inborn error of metabolism. They support the urologist in managing the patients with the kidney stones by setting up the renal stone metabolic clinics. The training pathway in chemical pathology is of 5 years of duration. A trainee is eligible to enter the specialty training after completing 2 years of foundation training program, followed by the 2 years of core training program. During this time, the trainee who has completed the MRCP or has got fellowship in other medical specialties such as GP or anesthesia or pediatrics or obs and gynae are also eligible to enter the chemical pathology specialty training program. And during this specialty training program, the trainee who successfully completes the training through the workplace assessments and examinations is awarded CCT at the end of the 5 years of the training program. The trainees in the specialty will initially develop knowledge of laboratory work together with the supervised learning, clinical license, and validation of results along with the direct clinical care. Trainee will demonstrate that they are achieving the competencies as recommended by the chemical pathology curriculum through workplace assessments. Following the completion of the RCPath Part 1 exam, trainee will continue to develop skills in the laboratory and in direct patient care with greater responsibility and less direct supervision. After passing the FRCPath Part 2, the trainee is also encouraged to develop a specialist interest. The CCT in chemical pathology will be awarded on the recommendation of the college following the evidence of satisfactory completion of chemical pathology curriculum objectives, satisfactory outcomes in the requisite number of workplace assessments, and FRCPath by examination. Each pathology curriculum outlines the capabilities in practice or SIPs, which describes the professional task or work within the scope of the specialty. Each curriculum contains both generic and specialty specific SIPs, and each SIP has a set of descriptors associated with activity or task. Descriptors are intended to help the trainees and trainers in recognizing the minimum level of knowledge, skills, and attitudes gained during the training program. By the completion of the training and award of CCT, the trainee must demonstrate that they are capable of unsupervised practice in all the SIPs. The generic SIPs, they cover the universal requirement of all the specialties as described in the GMC's Generic Professional Capabilities or GPC framework. The 6 generic SIPs include ability to function successfully within the NHS organization, ability to deal with ethical and legal issues related to clinical practice, a trainee communicating effectively and is able to make shared decisions with patient management. The trainee should be focused on patient safety and delivers effective quality improvement in patient care, able to carry out research and manage the data appropriately, and able to act as a teacher and clinical supervisor. The satisfactory sign-off will indicate that there are no concerns before the trainee can progress to the next level of training. The specialty-specific SIPs describe the laboratory and the clinical task or activities which are essential to the chemical pathology practice. There are 5 specialty-specific SIPs related to chemical pathology, which includes ability to lead and manage a laboratory, able to use the laboratory service effectively, ability to manage a multidisciplinary team effectively, contributing effectively to the management of problems in patients in other specialties, and able to lead and manage a clinical service. And again, a satisfactory sign-off demonstrates that trainee is performing satisfactorily against each of these specialty-specific SIPs. Good medical practice, or GMP, is embedded at the heart of the GPC framework. The framework describes the requirement to develop and maintain key professional values and behaviors, knowledge, and skills. The framework describes the principles, duties, and responsibilities of the trainees and regulates the response to the patient concerns and patient safety and fitness to practice within the medical professional. The GPC also informs the curriculum design and assessment in the specialty. There are 6 generic SIPs for the chemical pathology, which are linked to the descriptors informing the GPC domains and assessed through various assessment procedures to provide an evidence that the trainee is achieving all those competencies as defined by each category of generic SIP. Similarly, there are 5 specialty-specific SIPs for chemical pathology, again linked to the descriptors, informing the GPC domains and providing evidence through the assessments. The syllabus for chemical pathology has a broad scope covering both the laboratory and metabolic medicine. A trainee should be able to demonstrate SIPs and GPCs in each of these areas as outlined in the syllabus. Trainees will need to become familiar with the relevant knowledge, skills, values, or attitudes related to these areas. The focus of the syllabus is on patient, who should always be at the center of knowledge, learning, and care. Assessments of SIPs requires trainee to demonstrate a range of different skills and behaviors by performing tasks or activities. Trainers to assess that trainee is meeting expectations using the global anchor statements. There are 3 global anchor statements: meeting expectation for this year of training, and therefore the trainee progresses to the next stage of training. Above expectations for this year of training, again, the trainee will progress to the next stage of training. Below expectations for this year of training, that means the trainee may not meet the requirements to progress to the next stage of training, and this will require support for the trainee. For assessment of specialty specific SIPs, the educational supervisor will carry out the entrustment decision for each SIP and record the level of supervision required for the trainee. This will eventually culminate into an educational supervisor report, or ESSR, which will provide the overall performance using the global anchor statement, which I have just mentioned in my previous slide. All the trainees should have an access to the LEPT, where you will be providing an evidence on your assessments, and your education supervisor report will inform your training progress. Similarly, the assessment of specialty specific SIPs also require the educational supervisor report involving the global anchor statement. The learning outcome of assessments is to provide evidence that trainee is progressing from knowledge and understanding to the underpins the theory of learning, which describes the learning by action while trainee is undertaking the assessments. Trainee gains new experience by carrying a task or a clinical work or a laboratory work in the practice, reflects upon the learning gained, which creates a new learning. This new learning, through self-assessment and supported by the external feedback, consolidates the knowledge acquired and contributes to the trainee's professional development plan. And this forms the basis of assessments. The formative assessment is through the workplace-based assessment, which provides an evidence that the trainee is achieving the required competencies and performance at the workplace. During the chemical pathology training program, a trainee is required to provide at least minimum of 12 DOPs each in ST3 and ST4, to provide evidence on CBD, again minimum of 6 each in ST3 and ST4, minimum 6 ECE during ST5, ST6, and ST7 of the training program, and there are 3 MSF at ST3, ST5, and ST7 each, which are mandatory. However, you can have MSF at ST4 and ST6, and this can be decided by your deanery. Regarding these summative assessments, the major assessment is through RCPath examination, which has got 2 parts, part 1 and part 2. Part 1 assesses your knowledge, and a trainee should sit at ST4 and pass by the end of ST5. The part 2 you can pass within 7 years of passing part 1. You will come to know in detail about RCPath examination in this program later in one of the talks. There are 3 critical progression points. The first critical progression point is at the entry of the training program, which is ST3. The second critical progression point is when you complete your RCPath part 1 at the end of ST5. And the third critical progression point is at the end of your training, which is at ST7, where you have completed your training satisfactorily and is awarded a CCT. ARCP, or Annual Review of Competency Progression, is an opportunity provided for the trainee to provide the evidence of their competencies, and this culminating into an education supervisor report. ARCP takes place once a year at the end of each year of training, which is 12 months. It is a holistic assessment of trainees' performance, issuing an outcome which can be anywhere from 1 to 6. 1 and 6 are being the satisfactory outcome, whereas 2, 3, and 4 are unsatisfactory outcome for the trainee. The Chemical Pathology Training Program also provides flexibility to the trainees. Any trainee can apply for less than full-time training program, which is LTFT. It can be anywhere between 50 to 80% of a full-time equivalent. A less than full-time training is pro rata, which includes the training duration, assessments, and your leave. But the ARCP takes place once a year, and it is not pro rata. The trainee can also take the time out of training, which is called out of training program, for more than 3 months. A trainee can undertake research during this out of training program, which is prospectively approved by the GMC and counts towards CCT. Similarly, a trainee can join a clinical training, which is prospectively approved by the GMC. A trainee can also have clinical experience or career break during their training program, but this is not approved by the GMC. To summarize, the curriculum outlines the chemical pathology training requirements. It guides the trainers to what is required to deliver the curriculum and trainees in the learning and assessment methods, so that they can satisfactorily complete their training program. We would encourage all of you to register with the college. We will also like all of you to get yourself familiarized with the chemical pathology curriculum and assessments. This is available on the college website. So in the end, I hope you all have enjoyed this talk, found it helpful, and thanks for your attention. We are happy to take any questions from you. Thank you.
Thanks very much indeed, Vinita. I think it can be daunting for a new trainee to look at all of the paperwork available, to look at this big assessment. So I'm sure it takes a little while to get to grips with that. But I suppose if we think of the curriculum as a general roadmap of the training pathway and the syllabus as the kind of detailed nuts and bolts of what laboratory and clinical knowledge and skills are needed to underpin that, then it might, over the next 6 to 12 months, it all might make a bit more sense to our trainees. And yes, as Vinita said, please don't be shy. Please put any questions you have in the Q&A box, and we'll come back to them towards the end. So thanks very much indeed, Vinita.
Thanks, Ronan.
Okay, so our next speaker is Dr. Kevin Deans, who's chair of the panel of examiners for clinical biochemistry. And in that role, Kevin oversees all of the clinical biochemistry exams that you do. And I'm sure you're all very keen to hear what he has to say about what faces you in the years ahead. So I'll hand over to you, Kevin.
Hi, right, looks like I need to do this in a certain order or I can't unmute myself after I've screen shared apparently. So let's try this again. Screen share, and we'll do that, and we'll do that, and perhaps someone can just shout and tell me if they can see this in full slideshow mode now.
It's not in full slideshow mode, Kevin, but we can see So we can see your slides in the way that you would see them if you were, wanting to edit them. It's fine.
Oh, right. Okay. Okay. It probably means you get a sneak preview of the next slide as well as the current one, if I'm correctly understanding what you're seeing. But we'll run with it if you're all able to see something that's kind of useful. So yes, I'm the chair of the panel of examiners for clinical biochemistry. Kevin Deans is my name. I'm a consultant chemical pathologist based in Aberdeen, and I'll just take you through for a little while the FRCPath exams and just a little bit, perhaps. I don't want to give you information overload at this point, but give you the information that might be useful to you. So what is FRCPath, Fellowship of the Royal College of Pathologists? Well, it's the professional qualification that is appropriate for you as a medical trainee progressing to CCT in due course. And before you come out the other end of your training and are awarded your CCT, you'll have to have passed the FRCPath by examination. What's it doing? It's testing both your knowledge and it's testing your ability to use that knowledge in the day job, essentially, in the practice of clinical biochemistry or chemical pathology, as it is at this current point of time. And one of the key things to be aware is that the curriculum and syllabus are on the website, on the RCPath website. So if you want to know what's fair game, what's legitimate for material for the exam, there are no secrets about this. It's on the website. Go to the curriculum, go to the syllabus that's an appendix to the curriculum on the RCPath website, and that is what we are assessing against. So we don't want that there's going to be any surprises in this exam. You'll obviously not know what specific questions are coming up, but one of the things I really feel quite strongly about is that we want to make as much information available to you about what you should expect and what material to be preparing for. It's split into two parts, with part two being split into multiple parts. We'll come to that in a little while. Part one is a multi-choice question exam. It's single best answer format. Most people will sit this during ST4, that's to say your second year of specialty training. And as you'll have seen from the previous talk, you have to have passed it before you complete ST5. If you haven't passed part one of ST5, then by the end of ST5, then that would be grounds for issuing an outcome 3 at ARCP and requiring additional training, not being able to progress beyond the end of ST5 until you've got the part one. Part one, approximately 25% of the questions are knowledge-based, 75% are application of knowledge, and you can see a breakdown there of the different domains that are being assessed. And again, the body of knowledge that you're being assessed against is the curriculum. It's a 3-hour exam.
Sorry, Kevin, could I interrupt you very briefly
can.
just to say, on my screen, you're not moving through the slides.
Oh dear, that's unfortunate.
I'm still on slide 1.
Well, that's unfortunate because we're on many slides down. I'm going to try a new share on that. And do you know what we're going to do? I'm going to do this slightly old school here. I'm going to share that way. And what you're going to see there, I can guarantee that all you're going to see there is hopefully the screen, but I'm going to click manually through like that. And hopefully you're going to see, when I click like that, different slides. Is that correct? Are you seeing that now, Ronan?
Yeah, that's working fine, Kevin.
You are, right, okay. Here's what you missed. I was talking to there and talking to around the need to have your part one by the time you come out of ST5. Okay. And here was where we got to, and thanks to Ronan for letting me know that I was still happily chatting away to the introductory slide. Part one is a 3-hour exam. It's 125 multi-choice questions, 125 questions, single best answer format, and I'll show you an example in a moment. Calculations and formulae can be included, but they obviously have to be sort of questions that could be answered very quickly within the time limit for the question. And it's an online exam. I'll show you an example here. If you go onto the RCPath website, you'll see that all the stuff I'm about to show you is on the RCPath website. And we're keen to try and get as much material and get some more material up on the RCPath website so that, again, there are absolutely no surprises about the sort of thing that you're going to face. So this is one of the questions that if you go onto the website, you'll see So each question has a STEM, in this case, investigation of the aldosterone-renin ratio for detecting primary hyperaldosteronism can be affected by many antihypertensive drugs. So a STEM that gives you a bit of information that introduces the subject area for the question. And then you get your lead-in. What effect do angiotensin type 2 receptor blockers have on aldosterone and renin and the aldosterone-renin ratio? And don't worry that at the moment, as a new trainee, you're sitting there maybe thinking, I'm not quite sure about that. You could possibly have a go at this one, couldn't you? Because you say, okay, so these angiotensin receptor blockers, if they're blocking the angiotensin receptor blocker, I guess your aldosterone, which is downstream of that, is going to go down. And then by the impact on sort of lack of negative feedback, your renin's possibly going to go up, and so your aldosterone to renin ratio is probably going to go down. So you could probably actually have a decent bash at saying, actually, I think it's probably decreased aldosterone, increased renin, decreased ratio, and you would be absolutely right. But don't worry, by the time you come to sit the exam, I'm sure you'll be able to go in there and go, oh yeah, I know that. So that's just an example of the sort of question that you're getting, 125 of those in the Part 1 exam. And so you've passed that, hopefully, by, well, mainly you're gonna try that with an ST4 on the whole, and you're certainly going to have passed that before you come out of ST5, or you don't get to proceed beyond ST5. And then you have the joys of Part 2, and Part 2 is actually split down really now into 2 modules, for those of you that are going to be new trainees at the moment. And module 1 consists of 2 papers, so it's a physical exam. You come down to, it's usually in London these days, the venue can vary a little bit, but it's usually in London. And in the morning you sit an OSPE, an Objective Structured Practical Examination. That's a 3-hour exam. It consists of 19 questions. Average out, that averages out at about 9 minutes per question, with an extra 9 minutes over to check over your answers and so on at the end. Back in the old days, it used to be that you would actually move around different stations, and a bell would ring every 9 minutes, and it would all be terribly stressful, and you'd have to, down tools at the end of 9 minutes, move on to the next question. We've actually moved away from that particular format now, so you're now sitting down at a desk with the entire paper in front of you for 3 hours. How you allocate your time is up to you, but obviously it averages out at 9 minutes or thereabouts per question. And you're being presented with various bits of lab output, so you might see serum electrophoresis strips or traces, or chromatography scans, or hemoglobin breakdown product output, and so on. And you'd be asked some questions on them, and you'd have to write down short answers to those sort of questions, or clinical scenarios that you might be faced with, or you might be presented with some internal quality control or external quality assessment data. You might have you will have some simple calculations to do, but we're very much guiding towards the type of calculations that you would get are those that we would consider to be most relevant to the practice of chemical pathology in the current day. Again, the syllabus is your absolute guide as to what's in and what's out. And then there's one final question, which is the communication question. It used to be that we had a face-to-face communication skills question. It's now a written communication skills question. So it might be that a GP has written into you with this question about such and such. Please formulate a response in a format that would be appropriate to a non-lab specialist, or you've had a complaint in from a patient who's been told that their sample went missing. Please formulate a response to the complaint. And it's testing not only your knowledge, but also can you put that down in an appropriate format to communicate to a non-lab specialist. So that's your OSPE. If you want a sort of example, again, this one is taken from the website, so it's up there for everyone to see. This is one where you're interpreting lab traces, and don't panic when you look at this at the moment and think, oh, I wouldn't really know where to start with that. That's okay, because you've got a good bit, if you're a new trainee at the moment, you've got a good bit to go before you're going to be sitting this exam. But essentially, there's a bit of a story there about how you need to report this patient's alcohol level using the sort of gold standard gas chromatography technique. And what happens is you're given a trace there, and you're given some data about peak areas and peak heights. And by the time you get to the exam, that'll all be stuff that you're hopefully pretty familiar with interpreting, and you'll know how to use the patient data and the quality control data to essentially do some calculations and work out the quality control, whether it's in or out, basically, and therefore whether you can report the patient result and what the patient result is. And then might be a follow-on question or two there. Is the QC acceptable? Is there any difference in the ethanol measurement between the two methods? So that's just a simple example of one where you're using some lab data to do some calculations, and it's got to be stuff that's doable within about 9 minutes, because that's the average time per station. So it's worth being well familiar with all the stuff that is in the syllabus, know how to interpret these chromatography type outputs, know how to interpret serum electrophoresis, know how to interpret hemoglobin breakdown product, spectrophotometry, CSS spectrophotometry traces, and so on and so forth. That's just 3 examples, and there's no surprises there because it is all up there in the syllabus. So that's your OSPE. So you come out of the OSPE, and then you go and get some lunch, and then you come back in the afternoon, and you've got what's now the written practical. And gone are the days when we used to have a bench practical. You used to have to get your white coat on, and you'd be given maybe a spectrophotometer or whatever, and you would have to actually carry out experiments, plan your experiments, carry them out, right? That tried to be geared towards the sort of things that you might be expected to do in years to come, you know, when you become a consultant chemical pathologist. So maybe planning some experiments. Usually it's split into 3 parts. Experimental planning would be the first bit. So it might be something like, well, you're wanting to implement this new assay, write out an experimental plan for how a biomedical scientist might look at the limit of quantification or the imprecision, or compare with your current method, so on and so forth. And you'd write out that plan. That would be part A. And then you move on to part B, where you might be presented with some data from a different part of the verification and told, well, can you interpret, you know, here's a method comparison, for example, here's your current method, here's your new method, here's how the results compare, and knowing that there are different graphical techniques that you can use to represent those data, and different calculations that you can do to work out whether whether any difference between the 2 methods is significant. And then part 3 is applied conclusions, and usually that's kind of pulling the whole thing together and saying, right, what else would I need to do before we implement this assay? Or you might again be asked to do a bit of communication type stuff there, write a letter to your clinicians to say, right, we're going to change this assay, here's the key things we've found, it's going to be a difference in the results of approximately whatever, and explaining it all to a non-lab specialist. So again, it's a 3-hour paper. You're given it all at the start. It's up to you how you allocate your time. But again, you know, gear it towards things that you're likely to have to do in the day job, where, you know, in real life, what is it that consultants have to be able to do? They have to be able to, they're not going to stand at the bench usually and actually carry out the analysis, but when one of their scientific colleagues comes and presents some data to you, you need to be able to make sense of it, you need to understand it, and you need to be able to draw appropriate clinical conclusions. So that's what we're trying to assess in the written practical. So that's your part 2, module 1. So your OSPE and your practical, okay? And then you've got part 2, module 2. You can sit the 2 modules in the same sitting if you want. I mean, generally speaking, there's often an argument for saying do them in different sittings, unless you're against the clock on this and time's running out and training time or whatever. But it's up to you. You've got the choice of sitting them at the same in the same sitting or in separate sittings. Part 2, module 2 involves a written paper and an oral. The written paper is a 3-hour paper. It's a mixture of critical appraisal of 2 journal articles and 6 clinical cases. So, and the 2 parts count the same. The journal articles part counts for 50% of the paper, and the clinical cases count for 50% of the paper. For the journal articles, you're generally been given a couple of published papers. So they might come from, probably come from one of the specialty journals. You know, we frequently use the Annals of Clinical Biochemistry, for example. And we present a paper. It has to be a relatively short paper because you've got to have time to read it and make sense of it in the time available. And then we'll ask for, you know, can you make sense of what the paper says? We'll ask you some questions about that. We might ask you about some limitations of the experimental design or the findings. We might ask you about the implications. You know, does this influence what you might want to do in the lab? Does this mean you want to change your practice? That sort of thing. So can you read and interpret and appraise published research articles? And then the 6 clinical cases are exactly that. So here's one again up on the website here. So you're given a bit of a story and some results. So here's somebody that was brought to the emergency department and you're given some blood gases there, and you can, oh, right, yes, I see immediately that they've got a severe metabolic acidosis with partial respiratory compensation. In fact, there you go. There's the answer to part A. So there's 4 marks in the bag already. They give you some more results there, and you would work through some calculations to calculate the osmolality, to calculate the anion gap, to make sense of what those results mean, and to suggest appropriate further tests to be carried out. So that's just one example. So again, we're here to test this, the sort of things that you're likely to be presented with as in due course a consultant chemical pathologist. So could you spot that this one in front of you here is looking like it's likely to be ethylene glycol toxicity, for example? Can you advise on immediate investigation for a suspected inherited metabolic disorder at the level that you would expect within the curriculum, at the level that you would expect any chemical pathologist to be able to do? So there's 6 questions like that. So that's your written paper. And then the oral. Now, the oral, I mean, I think people do find it stressful because you know that you're on the spot. The examiners know that you find it stressful, and the examiners, at every briefing, I say to the examiners, we're not here to stress people out. People will be nervous. We want to try and let people perform the best they can. If they're at the stage where they're ready to pass, we want them to be able to demonstrate that. We're not here to trip them up. We're not here to catch them out. But we realize it is a stressful experience, obviously. So you come in, and before you see your first pair of examiners, you have 30 minutes to gather your thoughts. You're given 2 questions to gather your thoughts. Make some notes. The notes aren't marked, but they're there to aid you when you go in to see your first pair of examiners. And those first 2 questions, one of them will be a management question, and one of them will be for medical candidates, a clinical scenario. For scientist candidates, they'll get an analytical type scenario. So you do either or, but you have to do the one that's relevant to your background. So medical candidates will do the clinical scenario. And then you go into your first pair of examiners. You've got 20 minutes with them to do those 2 questions. So you'll spend on average about 10 minutes on each of those 2 questions, and they'll just chat you through, get you to chat through the answers to those questions. And then you come out and you start afresh with a second pair of examiners. So for the second pair of examiners, you don't see the questions beforehand, so it is a bit stressful. You haven't had a chance to prepare your thoughts, but it's 20 minutes for 4 questions, so 5 minutes each. But you know that one of those questions is going to be on lab safety, one of them is going to be on clinical safety, and 2 of them will be clinical scenarios. And you're starting fresh with 2 examiners. So hey, if you think, oh, the first pair of examiners, I'm not sure that went that well, don't worry, you're starting fresh with second pair of examiners. So put it out of your mind and start afresh. Here's an example of a management type question that we've used previously for one of the prepared questions. So you're on call, your consultant's Friday evening, just been called by your biomedical scientist. There's been a serious fire within the lab block. The entire block has been effectively destroyed, and you're asked, well, what would you do? And you want to have I think for this part of the exam, they want to know that you're safe, sensible, and legal. So, what immediate action would you take? What medium-term action would you take? What long-term action would you take? And there's obviously a lot that you could outline within that. And then this is an example of one of the short questions you'd get in that second set of examiners. And you're given a story. The results were printed out on a laminated sheet and handed to you, and you can immediately see, oh, this is a baby with an extremely high ammonia. And so again, we're not looking for so much for esoteric diagnosis or for recognizing that an ammonia that high is an absolute medical emergency and needs dealt with there and then, and knowing what you would do in terms of getting that escalated to the specialist metabolic team and advising to make sure the appropriate tests are taken off and so on. So again, we're testing at the level of knowledge that any chemical pathologist should have in recognizing the urgency of that hyperammonemia. And now for you, assuming that everyone who's listening to this is a new trainee, that will be it. We used to have a project, and we're in the transition phase of phasing out that project. So only candidates who are due to CCT before the 30th of April 2025 will have to do a project. So assuming that you're all new trainees and therefore your CCT date is well after April 2025, you will not require to do a project. So part 2, modules 1 and 2 are all that is required. So that's a bit of a whistle-stop tour of the exams. As I say, we know they're stressful. I mean, we do hear of people having been reticent about coming into the specialty because they're worried about the exams, and we don't want that. We don't want this to be a stumbling block or a deterrent to people. Yes, they are testing exams, but we want them to be fair exams. We want people to come out the other side feeling they've been treated fairly, and that if you're ready to pass, that you've had the opportunity to show that and hopefully to pass. And you know, we want, you know, we want to see people passing these exams. We want to see people having the opportunity to do their best and to do well. And as I say, we don't want there to be any surprises. So have a look at the stuff on the RCPath website. It's all there, and we'll try and, you know, keep putting more material up so that you're as well informed and as well prepared as possible about what to expect. Thanks very much. I'm happy to stick around till the end and take any questions during the Q&A session, but otherwise, thanks very much for your attention.
Thanks very much indeed, Kevin. I'm sure that our attendees have found it very useful to hear you take some of the mystery out of the you know, exam candidates often feel that that examiners for some reason have an evil streak, but of course in your specialty as well as mine, what we actually want to do is give candidates every chance to demonstrate that they're able to pass the exam, and we're not out to get them at all. So thanks very much, Kevin. I will move on through the programme because we have no questions for you just yet. And the next item on the programme is the ePortfolio, the LEPT system, and I can see Alastair is back with us, ready to go on that one. So I'll hand over to you, Alastair.
Thank you. So, hi everyone. I will just be sharing my screen with you in a moment. Okay, I'm hoping everyone can see my Chrome browser now. Is that all visible to everyone?
Yes, we can see that.
Perfect, thank you. So my name is Alastair, as mentioned earlier in some of the introductions. I work as part of the assessment team along with Sandra, and I am the ePortfolio officer. And a lot of that is, as I've mentioned, being the first point of contact for any problems or questions that you may have around the LEPT system. And today I'm just going to give you a quick run through of what the LEPT system is and the various aspects that you can use to help you with your training and recording various assessments and all that sort of thing. First off, I'm just going to show you the RCPath homepage, just rcpath.org, and you will see down in the bottom right here, we have Learning Environment for Pathology Trainees. This is the link that you will click on to get to your LEPT system. You'll then be signing in, if you've not signed in already, at the top with My RCPath, and that will then bring you to your LEPT account. This account in particular is a test account that we're using just to go through everything and demonstrate it for you today. So things like some of these assessor tasks, that looks quite scary right now. Ignore that for the time being, because that's going to, when you first log in, not show any tasks for you there. The other aspects of what's on this page, as the first page that you're going to be seeing when you log in, we have our alerts, which are notifications which we can make on the back end of the system, should there be any issues with the system, any downtime to be expected, that sort of thing, and any other things that are going on which we would like you to know about. So do at least occasionally have a look there to see if there's any new alerts which you've not yet read. The one thing I'm going to point you to within this alert, I understand that having lots of information thrown at you this morning alongside many different aspects and facets of this system is going to be a lot to take in. I don't expect you to remember everything that I've said today. But obviously, first off, this is going to be recorded. And even if you then weren't to look at this recording and look through my run through today, anytime you log into the system, you have LEPT instructional videos. This link brings you to a very good YouTube playlist of almost anything that you could need to do in terms of the LEPT system. And it just brings you to these YouTube videos where you can go through, select what it is you're trying to do, and it should then give you a step-by-step process by which you can create an ASAP or upload various assessments, whatever it is you're trying to do. But I will give you a brief run through of this today. As I briefly touched upon, you have your tasks menu. This is where you will have either assessments that have come back from your supervisor for approval or maybe for edits, anything that the system thinks you may need to be updating and taking a look at. On the messages on the right, you can use this function if you wish to message other LEPT users, though obviously most of the time when you have an assessment, you'll have that assessor's email. So that might be easier to use, but this is a way that you can keep the messages within the LEPT system and just access them there. I will briefly look at this training card at the bottom as well, which, by the way, we can move things around. This training card is essentially what it says on the tin. It is a summary of your training as is currently logged in your LEPT account. For the purposes of this demonstration, we just have all of these different labels marked with different members of staff. The 1 and 2 positions which I will make of note are the educational supervisor and the training program director. These two are the labels which the system will ask you to update when you first log into your account. You'll need to add whoever your educational supervisor and training program director are. The dean will be able to let you know that. And when you've then submitted that, you'll be able to use the rest of the LEPT account. These other aspects, head of school, may not be relevant to you immediately. ARCP won't necessarily be immediately relevant, though I will be going through that today. And then things like this ARCP panel chair and the external representatives, these will be given to you again by your deanery at the relevant time when your ARCP is due to take place. So it's fine that you wouldn't have these set to begin with. We wouldn't expect you to. The way in which you can change these different professional relationships is through this big blue release button on your homepage, which is always there. Clicking on this will bring up a menu where you're able to edit all of these and maybe a few more professional relationships. And it is worth noting that most of these people, or all of them in fact, when you have added them, will have read access to your account. So that's to be expected that your educational supervisor and training program director will. You'll only want the ARCP panel to have access as and when that's relevant, hence that's not currently set. We also have these little loading bars, each of which are demonstrating different assessments that you may take part in throughout your training year. For this account and for your account, you would expect that to be showing 0 to begin with, though as I go through today, you'll see what it looks like when you've completed an assessment and how that then adds to the total in green, where by the end of your year or by the time your ARCP is coming up, you will hopefully have filled out all of these. So the very first thing I will go to in terms of these different menus at the tops here is just this one on the far left, where we have just your home, which brings you to this page that I've been discussing now, but also your profile. So if I click on that, and when it loads, here is where you'll have various details that you've entered. Again, ChemPath West Mids, this is just a training account. If you would like, you are able to upload a photo of yourself. Once again, do note that that photo is visible to anyone who has read access to your account, but it won't be visible to just anyone or any of your colleagues, for example. In terms of the portfolio user details, here is where you can edit the various aspects of your training. For example, your job position, whichever ST year that might be, and wherever you are then based is then under your workplace. Specialty is obviously going to be chemical pathology. You can add in your GMC number here, and then your national training number as well, which again is a mandatory thing that you would want to be putting onto your record here. So then this can be logged by the training team at the college. CV you can upload if you would like. That again is optional. I'm going to point out here as well a difference between job position and year of training. You are fully welcome to put your job position with your ST3, for example, but please note that in terms of what the LEPT system thinks you are, that is what the year of training is. So if you've written when you are ST3, but for whatever reason, the year of training states a different ST, you would need to get in contact with us so that we can change that for you, because otherwise all of your assessments, ARCPs, that sort of thing, will potentially have the wrong year attached to them, and that can cause problems down the line, which obviously we want to avoid. Other thing as well, your email here is something that you'll be able to edit either by emailing us or in your main RCPath account. When that's updated, along with a number of other things with the LAP system, it's usually updated by the next working day. So if you've changed your email on one day, you will need to still be using the old email until the start of the next working day when the system has updated. Okay. We then have, I'll go first to the ARCP, which is the annual review of competence that you'll be having, which I think you had some info on that from some of our previous talks. When you're looking at this, you would be going to create and list, and there would typically be a create ARCP button, which you could click on at the top here. We've created one just for ease of use. Should you have any issues creating that, you can email us and we'll once again be very happy to help. Typically the ARCP duration, which we've got at the top here, you'll be inputting those dates and they will usually reflect the entire year. So the entire calendar year, but also from the start of your training year to the end of that training year. When you are making this ARCP, you will be asked to put in an ARCP date for the panel. You are clearly not going to know that at the beginning of your year as to when that date is. So it is fine to begin with to just put in a rough date at some point in the future. Though do make sure that that ARCP date is in the future and that the ARCP is due to end in the future. And that will then keep your ARCP open. And this is the key thing. We want to keep this remaining open. So you are then able to edit the ARCP as you will, as well as add items to it, which is an aspect that I'll go into now. So under the assessments tab, this is the bread and butter where you are going to be listing all the different kinds of assessment that you'll be carrying out. You might, for example, go here, ignore for now the fact that there's some already. This is again just for the testing. You will see none when you first log in. You will then want to add one. Click on this create button here in the top right. We then have some information about this here, which essentially says both you and any assessor that you've given that you've had an assessment with and you've given access to create an assessment for will be able to make an assessment for you. And essentially, if you create the form, then the assessor needs to approve it. If an assessor creates a form, you will need to approve it. In all instances, you will ultimately be approving and rejecting any assessment that you do. But to begin with, the very first steps that you would go through is filling in anything with a red asterisk, where you would select, for example, the person who is approving your assessment, so whoever it is in your day-to-day that has done this assessment for you. If they are not already on the LEP system, which they won't be to begin with, in terms of your quick select list, that is, you will click Other, Find, and then when you go through to create assessment, you'll have the option of putting in a name and searching for someone on the LEP system and adding them at that point. Occasionally, you may be being assessed by someone who does not have a LEPT account. That is no problem. You can then select Guest Assessor, at which point you will then immediately, rather than after creating assessment with the searching function, input title, first name, surname, email. Please ensure that the email is correct. Do double check that with the assessor, because then the guest assessor will be given a one-time login link to have access to the assessment that you've created, and they'll be able to then hopefully approve or send it back. We say reject. It doesn't mean it's been completely rejected. It just means maybe there's a change they want you to make or something, some issue. If it's rejected, it gets sent back to you. You can then make amendments, send it back to them once again. This will be again via their email. They'll then be able to approve it, and then it will land in your account for you to then associate with an ARCP. So just to make sure that this email is correct, for the time being though, for this demonstration, I'll select myself, choose an assessment form to complete. So for example, we could go with a DOPS here, and then I'll just be clicking Create Assessment. Now, something that is not for you to be concerned about as of yet are these things below. So we've got this here and this one here. This section here is if you are assessing someone else, and you would then be selecting someone and creating an assessment for another person. You are unlikely to be doing this to begin with, but down the line, this is something you can do. This part is not part of this. We have the MSF assessment, which is the feedback that you'll be getting from your colleagues and supervisors and such like. Again, at this point in your first year, or ST3 for ChemPath, you won't be initiating this assessment, your deanery will be, and they'll be getting into contact with you for that. So this, again, isn't something you need to worry about right now, but in future training years, you'll be able to be the one to initiate your own MSF, which is the multi-source feedback, and that's for them, but not for now. So to go back here, I've selected who's assessing you, what it is that you're completing, click on Create Assessment. That then loads up with a variety of bits of data. Date of assessment, your name, that it's adopts, etc., etc. You'll need to then just fill in all of the things with a red asterisk, so who your assessor is, the brief outline. So again, I'm just going to say test procedure for now. If there are any appropriate skills within this, this is not mandatory, but if, for example, you're doing an assessment of pipette technique, you can click that there. If there are any learning outcomes in particular that you want to write here, you can do that. And then here is a section for you to self-reflect, and you can put what you've done well, what could be done differently, and next steps. But do bear in mind that as it says here, the assessor has the ultimate ability to amend comments because they'll be the ones broadly, that will be telling you what was done well, what could be done differently, and next steps. So again, if I just put test for all of these, you would then be able to either save as draft or submit to the assessor. Let's say you don't have time to completely fill this in. You can click save as draft, which I'll do today just because I'm not going to switch into my account just to approve it. You will then see that at the top of your training assessments page, we've got that there. This docs, which we've just done, is marked incomplete. It hasn't been sent off to anyone yet. You then have the ability to edit or delete it if needs be before it's sent off. Now, assuming you had sent off an assessment and it had come back to you, you would then have this approved assessment from your assessor just here in both your assessment list and on the task list on the homepage. It's at this point that when it's been approved by the assessor, you can then start to associate it with these SIPs and GPCs as were discussed in one of the previous talks today. So you would want to click on this. Once again, you'll maybe just want to have a little check to see everything here is what you're expected. And you'll then be able to select which of these assessment factors are relevant to the assessment that you carried out. And let's just pick some for now, which I'm just selecting essentially at random, but you will obviously give a little bit more thought to this. Then based on these that you've ticked, these GPCs will then be auto-selected to these specific domains 1 through 9. Again, do double check. Usually, like we would expect, appropriate and timely liaison with other medical specialty services when required. If that's highlighted, well, it's gone under the same domains as one of the other ones, but we would expect those to be relevant to these domains, but do have a check just to make sure that this seems reasonable, because this will be viewable by both your educational supervisor for their report, as well as the ARCP panel at that time. Then, when you have completed this, you then click Add, and we now have a completed assessment, which is now logged on your page as this lovely complete assessment here. The very next thing that you would then want to do potentially is, if you've created your ARCP, you'll want to associate the assessment that you've just done with that ARCP, so that you've done it within this specific timeline, and you will then be able to click into the docs. Then under options, click ARCP. You then have the option to either keep it in your portfolio, should you not want to associate it yet for any reason, or to associate it to the ARCP that you've created. Note again, it's open. You'll only be able to associate to open ARCPs. If it says under review or closed, then you won't be able to do that. So that's why I'm saying make sure the dates for the ARCP are correct. And most importantly, that the assessment you're completing, this one here, 2nd of September, falls within the ARCP period that you've put. You will then be able to click that, click assign, just like that. That has then assigned it to your ARCP. We can then go and check by going to ARCPs, create and list, and we'll now see under the assigned items that there is a 1. Click on that. We can now view everything that is here, which for now is just 1. But this can be anything. This can be, you can associate with your ARCP all manner of different items, whether that's these various assessments you can select, as well as other documents and any other audits or logs that you may have completed. I'll be getting onto that in a moment. There will be a point at which you will then want to also create your ESSR, which is your Educational Supervisor's Structured Report. It's under this ARCP menu that you'll be able to create ESSR, And you'll only be able to do that once you have at least one assessment logged and associated with this ARCP. At which point you can then click Create ESSR and tick these buttons to understand that this is what you're doing and that you've read everything here. Because first step is initiating it, and then you would need to complete and send it to your educational supervisor. Again, this will be down the line, and you would not have just one assessment associated here. You'd probably have a variety of different things based on what you've done throughout your training. Do make sure, again, with the ESSR when you're filling it out, although you won't be able to edit these within this form, make sure that these are all correct. You'll see again, this is pulling data from the profile page. So as long as that's been updated, this will then be put onto here. You can then select your type of appointment. For this, I'll just put test appointment. You may also have a GMC program and or post approval number. This will again be given to you at the relevant time, so don't worry about that now. I will just put a number for the time being. It demonstrates your training time. So if you're full-time, then it should say 100. If you are less than full-time, it will again mention that you are, for example, 80%, 50%, whatever LTFT you are. This will also demonstrate any previous ARCPs, which again, nothing to begin with. Previous placements in programs. So I mentioned this sort of demo post with a test address. This could have happened previously. All fairly straightforward and sort of makes sense as you read it. Again, not mandatory. If you had any gaps in training though, this is where you would put that. Here you will then have a summary of all of the workplace-based assessments that you have done. Usually this table will be quite a bit longer than just this one, but do check that everything that you expect to be there is, and that there's also nothing there which you don't expect to be there. When all of this is then done, for example, you may also have added some logbook items or audits or research projects or publications or teaching activities, etc., etc. You can go down and then submit and send to your educational supervisor, who will then be able to approve or reject it should there be an error or something they want to amend. If it's rejected, it will then go back to you to then complete, and you'll be able to send it off. At this point, nothing is initially locked and uneditable, but do bear in mind that if you submit and send to your supervisor, and then if your supervisor says okay and approves it, at that point, the ESSR becomes locked. And if anything were needed to be changed on that ESSR, you would then need to contact us and we should then be able to help. For now, I'll just save that because, again, I'm not going to be showing how the assessor would see it, but it will just land in their task box, much in the same way that your task list will have various things that you'll need to be doing. If we now go back to the homepage, I am hopeful, yes. We see now, because we've submitted one assessment, in this case, one of your 12 DOPs, we have one green square rectangle filled out. Over the course of your year, you'll clearly be aiming to fill these out by the time of your ARCP. This is just a very quick way that you can take a look and say, okay, how am I doing? What do I need to focus on? For this training card to be there, you will need the ARCP to have been created. And this is essentially pulling data from that ARCP. So if there's any errors on the training card, it's likely that there was some kind of error in the ARCP. Once again, you can send us an email, give us a call, and either myself or Sandra will be very happy to help you there. In terms then of these other tabs, which I'll briefly go through, if the assessments are for these more formalized assessments that go here, you may have other things that you want to add as well. For example, under your training development, you can create and list personal activities. These can be a variety of different things, but it would be anything that you have undertaken, for example, an audit, logbook, any kind of personal activity. If you've been to a conference, something like that, that doesn't quite fit under the assessment, you can add that here and you'll be able to fill it out, add some attachments, associate it once again with SIPs and GPCs, and document that and add that in that way. In terms of your training rotations, I put one demo, one here. But again, if you were to create this, you can again say what your rotations have been, where it's been, all of these details, once again, just for your own records, as well as for the records within your ESSR and your ARCP. Finally, you may have some personal resources that you want to put up. Once again, these are a variety of different things of what they could be. And maybe you have some files that you want to demonstrate a project that you've worked on. Anything that you've done that you don't think fits in some of the other areas, you can put here as an additional resource, and along with an area here for you to add a description, just to say what exactly it was that you've done and justify which of these that you're selecting and putting it under. All of these can then be added to your ESSR. All of these can then be through the ESSR and then through the ARCP form, will be seen by the ARCP panel at the time of your annual competence review. So do keep on top of all of these things. Try not to feel too overwhelmed by it. It is sort of taking one thing at a time. And as always, if you have any questions, we're here to help. Though, once again, there is also a help function here where there are a variety of different helpful forms which may be useful for you. For example, the number of assessments that you might want to be doing for chemical pathology. We have this document here, which will give you just an idea of where you need to be heading in terms of these different numbers. This is also on your training card on the home screen. Once again, though, I'll also take this moment to mention the LEPT instructional videos here. These, once again, contain a single video on every aspect of what you are able to upload within each of these tabs. So once again, don't feel that you need to remember everything that I've been saying here today. You can look at these instructional videos and they will be there to help. Should that still not answer your question, or you're encountering any other kind of error, do just send us an email at assessment@rcpath.org, or you can give us a call and we'll be happy to help. So I don't know if we've got, okay, so I'm seeing there's some Q&A's questions here. So one saying, I'm currently 70% less than full-time. Is the number of assessment DOPs showing on LEPT be adjusted? To my knowledge, no, it won't do that. I don't know if Sandra can, I think Sandra's typing an answer here to give a more full answer there. In terms of, oh, so that's been answered. So yes, I am correct. So no, it does not change, but this will be something that will be taken into account, obviously at your ESSR, but also at the ARCP panel. It will show there that you are less than full-time, and it will show that in your account, and that will be taken into account there as well. Okay, in terms of the question of when should I expect to have a national training number, I think Jenny is asking to answer this question. So I don't know if Jenny wants to.
Yeah, they'll get them from the deanery, but it varies from deanery to deanery. So she should get the number any time from now, but it could take up to a month, 6 weeks.
Okay. And so, yeah, that was very much a whistle-stop tour of the LEPT system. I hope that was really helpful. Again, though, any other questions, please do feel free to reach out either in the Q&A today, or if anything comes to you after we've finished, you can email us and we'll sort it for you then. Okay, thank you so much.
Thanks very much indeed, Alastair. Whenever you move to a new ePortfolio, it can take a little while to get to grips with it. So I can imagine that the trainees on today's webinar are looking at your presentation and thinking, goodness, this is all new, because I guess many will have moved across from the physician's NHS ePortfolio system. So it will take a little while to get to know the LEPT system, but you'll get there. And as Alastair's said, you know, there's the help function, there are instructional videos. You've got, of course, good colleagues, both trainees and supervisors, who can help you with the system, and ultimately you can contact the assessment team, and Alastair or Sandra will be able to resolve any queries that you have. So we've had a couple of questions, and it looks like they have been largely answered. If anyone wants to come back on any of those questions, any of our panel, please do feel free. But in the meantime, we'll move on to our next presentation. So the next speakers we have are from the Trainee Advisory Committee, and I'm delighted to say that we've got two trainees from your own specialty who have come to talk to you today to give you their perspective, and perhaps to tell you also about the Trainee Advisory Committee. So welcome to Agnieszka, Jakubowska and Matthew Waite, who are going to give you a rundown. I don't know whether you've got a presentation you want to share, but feel free if you do.
Yeah, we do. I'll just try and share my screen. I think. Does that work? Can people see my screen?
I think so, Matt. Looks like it's working.
Sort of. Yeah.
Perfect.
My molecules. So I'm Matt, and Aggie and I am going to give you a quick welcome talk. Perhaps just talk a little bit about sort of the trainee perspective, and then I think Aggie will sort of finish off talking a little bit about the Trainee Advisory Committee. So first of all, I guess it is my pleasure to welcome you to our specialty. Very well done for getting in. Congratulations on getting a number. And I was thinking about when I applied, and I wrote that the specialty really gives you the opportunity to be a physician, a pathologist, and a scientist. And I still think, sort of a year in, that's really the defining feature of the specialty. And you'll note that most consultants do sort of differing amounts of all three of these roles. And I was going to talk about all of them a little bit in turn. So as a pathologist, and it's definitely more of the lab-based side of the role, there's definitely lots of new areas that most of you, just like me when I started, will have really limited experience of, and specifically sort of the lab theory and analytical methods. I've included TEATS here on the right. This is or sort of the main textbook, which I think is worth getting. I did at when I first started. It definitely covers most, if not all, of the things that you need to really sort of understand the laboratory and understand the laboratory medicine. Try not to get too overwhelmed when you first open it, but it all does start to sort of fall into place after some time. The exams, I think, are sort of very focused on this sort of laboratory-based side of things, and I think perhaps for that reason they can be quite difficult. And it's definitely something to think about, even as you're starting. That the exams need quite a bit of a run-up. We'll talk a little bit about places to start later. And one other thing that I'll mention from this side is that I perhaps didn't expect so much was sort of being involved with lab management from very early on. There's sort of lots of opportunities, and I think the lab really appreciate your sort of understanding of how things work on the wards. So that's definitely something to get involved with and think about. And as from a sort of physician perspective, I think that you're really a definite link between the laboratory and the clinical teams. And I really think this is our unique selling point, and why we're really irreplaceable in the lab. But from a specialty, though, there are opportunities for inpatient reviews and advice. And it's worth saying that if you think that there's a service that you'd like to offer and would like to develop, there's often lots of opportunities to do that as well. I'm sure you're aware of the sort of 5 main domains that sit under our umbrella, and I think there's sort of lots of opportunities even sort of outside of these classical things if you want to get involved. And I think the other thing to say is that lipidology, diabetes and obesity is really starting to fall under an umbrella of cardiovascular risk, which is quite a developing and sort of forward-moving field at the moment. There's a lot of talk about, which we're definitely sort of able to be part of and get involved in. And sort of from the third sort of perspective as a scientist, I'd like to say that multiple aspects of the specialty really lend themselves towards scientific research. There's definitely lots of opportunities, and you've definitely got more time to sort of get involved in these opportunities. You probably didn't do an internal medical training if you're coming from IMT. And definitely consider further qualifications, things like fellowships and PhDs as well. Finally, just before I hand over to Aggie, I'd just like to make a really quick point about analytical methods. I think this is a really new area to doctors and can be a little bit overwhelming, especially remember at the start of ST3. These are things like understanding how liquid chromatography works, about electrochemistry, things like that. And just sort of definitely take it slowly. If you do want to look in the textbooks, try not to get overwhelmed by the amount of information that's there. This is a little unofficial. It's not sort of devised by our RCPath, but more by Aggie, myself, and some of the other doctors at Imperial. We've organised a sort of analytical method lecture series, which is aiming to start towards the end of this year, should be in November, that will sort of try to cover some of the basics and allow you to sort of hit the ground running. I'll try and publicise this as sort of widely as possible closer to the time, just because it hasn't been fully sort of finalised yet. But please feel free to email me. I've just included my email here just to make sure that you're on the list so I can get it out to all the right people. But that's sort of everything that I wanted to say, and I'll sort of pass on to Aggie. I don't know if Aggie, you want to, I'll just keep clicking for you if you want. Is that?
Yes, that would be great, Matt. So my name is Aggie. Can everyone see me, or my video is on? But can everyone at least hear me? Perfect. So I am an ST4 registrar in East of England, and I think, as Matt has mentioned, when you start the specialty, it can be a little bit potentially overwhelming because it's so different to what a lot of our training has been in the past. And some of the starting points as well are making sure that you have joined the right organizations and are receiving information about the training days that might be running, and also information about potential resources. So I hope most of you are by now registered for your portfolio at RCPath, and that will mean that you are also on the mailing list for the college. We work extremely closely with Association of Laboratory Medicine, And I would advise for everyone to consider joining the association as a trainee. I think it's £12.50 a month, but it's you can then claim it back through tax as well, at least partially. The reason to join is that we work very closely. They have a lot of resources, both for medics and clinical scientists, and they also run annually UK MedLab, and you do get a discount if you attend that as well, if you are a trainee member. Another great resource is to join the ACB, so Association of Laboratory Medicine, Clinical Chemistry email distribution list. So if you have any queries within the lab, maybe whether there's a specific method that might be delivered somewhere across the UK or even worldwide, you can ask on the list, and it tends to be very active, very helpful with a lot of expert advice. I would also consider joining Association of Clinical Pathologists. So again, this association works very closely with Royal College of Pathologists, and it's free for medical doctors to join as trainees. I've already mentioned UK MedLab conference, so that's a big conference that happens annually, and it's sort of more from the laboratory perspective. Heart UK is another conference which is very much, it's a cholesterol charity and it's very much lipid based. And again, a lot of chemical pathologists attend that conference. Another great resource which is free is Clinical Chemistry AACC sort of website. So this is the American Clinical Chemistry Association, and they run some brilliant series for analytical methods and clinical chemistry, which you can do in your own time. Could we go on to the next slide, Matt, please? So currently we have a trainee WhatsApp group. So it's an unofficial group, as there are not that many of us. There are about 70 members in the group. It's probably currently the easiest way to communicate with everyone, and just sort of advertise if there are any training days happening, or if anyone has any queries, or sometimes just looking for some feedback. So it's completely up to you whether you would like to join, but this is the QR code for it. And I can also, I'm happy to leave my email as well in the chat afterwards, and you can message me if you would like to be added. Perfect. Go on to the next slide. So trainee advisory committee. So I will just talk a little bit about different committees that we have and what the purpose of each committee is. So trainees advisory committee, this is the committee which has trainees from all pathology specialties. So that will include, histopathology, hematology, immunology, and it's all the doctors and clinical scientists in training. So the purpose of this committee is to discuss training needs specifically, things such as exams, assessments, curriculum, well-being and support. The meetings happen twice a year, and you will have an opportunity twice a year to submit questions or concerns on the Royal College of Pathologists website. So I will try to advertise the time frames when the question portal is opened, and please submit any queries that you have prior. If we can move on to the next one. Then we have two other trainee committees. So we have the Specialty Advisory Committee. So this one will cover, in our specialty, that covers biochemistry. And in this committee, we have both clinical scientists and doctors. And the purpose of this committee is to essentially set the direction and specific professional issues for biochemistry as a whole. Again, my role on that committee is to provide the trainee perspective. I don't think there's a specific sort of question portal open for that committee. But again, if you've got any feedback that you would like me to sort of put across during the meetings, which again happen twice a year, please do get in touch. Then we have a college specialty training committee, and this one is specifically for chemical pathology. So this is where your training program directors meet twice a year to discuss matters specific to training. And again, I would very much encourage you to speak to your training program directors if you have any concerns, or to speak to Matt or myself if there is anything you would like raising during those meetings. Could we have next slide, please, Matt? And finally, what I would like to say is that your feedback really matters. So we are a relatively small specialty, and if we don't know that something is happening or people are not speaking up, then we can't make any changes. Different views are encouraged. So our role here is to represent everybody, even if there are different views within the specialty. It's our role to bring those across and voice them. So please use the question portal, and I will be advertising it prior to the meetings. I am very much happy to be contacted at any point with any concerns, questions, queries. You are also very much encouraged to speak to your TPDs or your educational supervisors. If you have any urgent issues, those can be raised prior to scheduled meetings as well. So it's important that we know about them. And finally, welcome to the specialty. I hope you have a brilliant training experience, and we are here to support you.
Thanks very much indeed, Matt and Aggie. That was a really very nice presentation. Some of the new trainees will in due course engage with the Trainee Advisory Committee and maybe even join that. You never know. So thanks very much. If you're both free to hang around for a few minutes just to see if there are any questions, that would be fantastic. In the meantime, we'll move on to the next item on the agenda, which is the pathology portal. And we have with us Luke Thrower, who's the pathology portal officer at the college, who's going to give us a quick summary of the portal, and we'll maybe pick that up whenever Luke has finished his presentation. So I'll just hand over to you, Luke. Thank you.
Great, thank you very much, Ronan. Hi there, my name's Luke. I'm the pathology portal officer at the college, and I'm going to give you a brief run through of the portal. To give you a bit of context on the pathology portal, it's a catalogue available on the NHS England Learning Hub. The pathology portal was launched in August 2022 and offers a collection of over 5,500 resources across various specialties, including case studies, lectures, recap videos, podcasts, and quizzes. Resources have been accessed more than 195,000 times so far by over 4,000 users from different backgrounds, and the project has grown a lot during the last 2 years, with more than 100 editors, including trainees like yourselves, who are working on developing content for us. We've been recognised with awards from the HSJ and the Healthcare Honours, and we've received some lovely feedback as well from users saying about how the pathology portal has been able to support their development. I'm just going to share my screen, so we'll check that this is going to work. Is that showing up for everybody? Are we okay?
Yep, that's perfect, Luke.
Perfect, great. So it's quick and easy to sign up to the pathology portal, and we've got links for this on the college page for the pathology portal here. You'll also find our support email on the right-hand side where the team can pick up any of your queries. We're always happy to hear from you, so please do get in touch with us if you need help. It's also worth noting that when you are logged into the Royal College website, on your My RCPath drop-down, you will have a button here. So mine says access the pathology portal. The first time round, yours will say create/link a Learning Hub account to the pathology portal. And this gives you a nice, easy way to have a single sign-on point to get to the Learning Hub. If I click that through, because I've been logged out, it will take you directly through to the pathology portal. I'll show you the Learning Hub side here. So I'm going to log in. So this is the homepage of the Learning Hub. The pathology portal is just one of the catalogues. So if you scroll down, we are very nicely placed in the #1 spot for most accessed. On the first time that you log in, you will have a green button up in the top right-hand corner here that will say request access. That only needs to be done once. Usually we'll respond to that request within a couple of hours, but sometimes it can be just minutes, and then you'll be able to access all of the resources. On the main page here, you have a spine which shows all of the different specialties, and so all of the resources are found within these catalogues. If I click into clinical biochemistry here, you'll see that they're then further broken down into different subcategories. As I'm an administrator for the portal, you'll see that there's some grey folders here, so these won't show up when you're logging in yourselves. A lot of the subfolders are organised from level 1 through to level 5, so this roughly represents their level of complexity, with level 1 being the most basic and 5 being the more complex stuff. With chemical pathology specifically, we have an individual editorial subgroup of volunteers who meet on a regular basis to work on developing content and to build better networks for resources as well. Current resources that we have, you see here, is profile interpretation cases. We also have some inborn errors quizzes and other clinical cases and scenarios. There's a real focus from the team there to work on content for trainees. So if you would like to get involved and give your feedback, please do get in touch with us because we find it really beneficial. If you've not used the pathology portal before, I'm just going to run through 2 quick examples of its functionality. But as with most things, I'd say the best way is to sign up, to explore for yourself, and to discover the content. So I'm just going to jump into 2 examples here, one of which is our inborn errors quiz. Now, I'm not a pathologist, so we'll see how I get on with selecting random answers for these questions. But just to give you an idea, we have a piece of text here, multiple choice questions to test you, and then you can submit your answer. And then we'll get a summary. I'm not entirely surprised that that's the case, so I've scored 0% there. And so that can just give you a little bit of a test. Some of them also contain pieces of feedback that you can look over. We have some of them which will contain videos or guides to go along with. Another example is our profile interpretation case. So this one gives you a case scenario and a profile to look over. And again, you have a selection of questions that you can answer. Again, excuse my answers. We'll see how I get on, whether I get some of them correct. Not quite right, but I did get 3 of them, so that doesn't feel too bad. So here I've been given a not quite right answer, and I've been given some extra context to the answers that have been given to try and support the learning. As I've put some you can rate the resource as well, and this is a really useful tool for us to keep an eye on how resources are being used, whether there are things that we need to look at. And then your bookmarks can work as your kind of own independent library to return to resources that you are finding helpful or resources that you are working your way through. You're also able to get a record of your learning from the Learning Hub. So in the My Learning tab up in the top left here, you can have a look at all of the content that you've accessed over a different period of time. So that's an easy way to return to things as well. It will show you whether it's been completed, viewed, or whether it's in progress. And then you're also able to download a PDF of your learning. So that can be really helpful if you want to use that towards self-accrediting for CPD. As I say, we do really value your feedback. It's been immensely helpful for us to keep improving things. So please do keep in touch with us. And as I say, if you'd like to get involved in developing resources, we'd be really happy to speak to you about that as well. So that's a very whistle-stop kind of view of what the Pathology Portal has to offer for you. Sign up, explore for yourselves. There's loads of content on there. There's also a search function, so a lot of the content isn't just restricted to necessarily the catalogue that you're in. So if I go back to here, you'll find a search catalogue button across all of the pages, so you can also search for content in here and take you directly to those. So you can sort and filter here. So if you're looking for a particular type of resource, like a video or just cases, you can do that as well. Thank you very much for your time. Best of luck on the journey, and please do get in touch if there's anything that we can help you with.
Thanks very much indeed, Luke. That was a really nice whistle-stop tour of the pathology portal. And I guess, you know, it'll be obvious that the portal is a valuable resource for trainees to use for their own learning. But as you kind of mentioned, we really like to receive contributions to the portal from trainees. And it's really easy to think that that you have to be some kind of expert to make a contribution or submit material. But of course, that's not true, because as new trainees, you've got quite a unique perspective on what's useful learning material, and I'm sure you'll encounter things during the next 6 to 12 months that you find educationally really useful. And so we'd really encourage you to talk to your peers and talk to your supervisors about how to capture some of that learning material, be it case-based material or otherwise, and upload it to the portal. And Luke, what's the best way to do that? Or who's the contact person, or how do trainees engage with uploading material?
Sure, yeah. So that contact email on the college website for the pathology portal at rcpath.org. If you get in touch with us there, we can then cascade that to the editors and put you in touch with the right people for what you're looking to do. We're really happy. It's, you know, we get contacted all the time for resources to be added. It's a really straightforward program, piece of UI design to add new resources. They can be added very quickly. So it's not something that you're going to need to do, you know, lots of training on. It's quite intuitive. So yeah, just drop us an email at pathologyportal@rcpath.org and we'll go from there.
Great, thanks very much. And of course, just to signpost, one of the important outcomes in trainees' curricula are providing evidence of how they are able to act as teachers, and developing material for the portal would provide some evidence for your portfolio along that line. So you might think about it as a way to help to support that as you go along. Thanks very much indeed, Luke. So we've got to the end of today's programme. I hope that you've all found that a useful morning. There's been a lot of material covered. I'm sure too much for you to have taken in all at once, but what you have got are some signposts for relevant and important items that you will need to keep in mind as you go through at least this year and the remainder of your training thereafter. The other thing you have in the chat are some points of contact from Matt and Aggie. Survey for this morning's webinar. So all that remains for me now is to thank you. Firstly, the panel for coming along to share your pearls of wisdom with the new trainees. That's much appreciated. And of course, the new trainees as well. Thank you very much for joining us today. You're all very welcome to chemical pathology training, and I hope that you all feel part of the college. Because one of the things that I often say is that the college is us. We are the college. It's a community of fellows, trainees, and members of staff. It's not some lofty and distant entity. So we hope that you really will get involved with the college and college business as the opportunity arises. As I said at the start, this webinar will be available on the website for you to view in future if you want to look back at anything and pick up some of those contact details that you might value as time goes by. So thank you very much again, and I hope you all have a good day.